Good afternoon. Today is Wednesday, March 19, 2025. The time is about 5 minutes past 4:30. I call the Insurance Committee of the Tennessee House of Representatives of the 114th General Assembly to order. Madam Clerk, please open the roll. Members, please remember to log in. Mr. Hakeem, okay. Mr. Clerk, please count the roll.
Mr. Chairman, you have 17 members present. You have a quorum.
Thank you. Members, do we have any personal orders? Chairman Martin, you're recognized.
Thank you. I've got two today. First on the front row are our EMS Day on the Hill folks from all over Tennessee, rural Tennessee, urban, all in between. So give them a shout for these guys here on the front row. Greatly appreciate what they're doing. And also in the back row, I don't often get to recognize my wife, but my wife is here today. So everybody turn around and look at Krista and embarrass her. Thank you for her being here as well.
Well, thank you. That was well done. Are we supposed to show how much we love you? And coming back to EMS, gentlemen, thank you. We are grateful for what you do for our state and our country. Thank you. Any other personal orders? Chairman Grails, you're recognized.
Thank you, Mr. Chairman. And I do not want to be outdone by Chairman Martin because my wife is sitting right beside his, and I do not want to go home in trouble. So I'll recognize my wife right beside her. She's the dark hair. And Chairman, I'd also like to recognize I have a constituent here, Mr. Dan Folks, and he has a couple of his friends from Gibson County EMS over there. So he's a good friend and good fella, and one of the best barbecue cookers around. So
Wonderful.
My daughters think the world of him whenever he starts putting those ribs on.
Well, thank you. Chairman Grills, showing love to you is going to be a little more difficult. Any other personal orders? Very good. We'll move on with our calendar. We have 8 items, but some of them are going to be rolled. Okay, 5 items. Item 1 on our calendar is House Bill 0927 by Chairman Hawk. We have a motion and a second. And Chairman Hawk, I don't see an amendment to this.
No, sir.
So on this bill, you're recognized.
Thank you, Chairman and members. House Bill 927 comes to us from the company Aflac. It is a bill that makes a change to expected benefit insurance. Expected benefit insurance is an insurance product that pays the policyholder money to cover lost wages due to an accident or illness and does not go directly to the health care provider. The policyholder can use the money for copays, bills, child care, mortgages, payments. We've all seen the commercials. This bill clarifies and distinguishes supplemental products from major medical, and that supplemental insurance does not cover mandates that major medical insurance covers. It essentially, as we said, it does what the commercial says they do with Aflac. Welcome any questions or comments, Chairman and members.
Well, thank you for the explanation. Members, do we have any questions? Chairman Sparks.
I just want to tell you thank you for carrying this bill. My wife has a few policies, and I met with the Aflac representative, and he was sharing about, I guess, Japan, that's where their high sales are, about, I guess, potential for cancer rates there. But my sister had bought a policy from Humana, and when she was in the nursing home, what upset me is that they would tell me on the phone she had 120 days of skilled nursing. Then the nursing home would reach out, and they would deny her each time. So, I want to thank Aflac. Thank you, Representative Hawk, for carrying this bill.
Thank you.
Thank you, sir. We have a commercial. Any other questions, members? Question's been called without objection. We are voting on House Bill 0927. All those in favor, please vote yes. Opposed, no. Mr. Clerk, please count the roll.
Mr. Chairman, you have 15 ayes, 0 nays.
Thank you. The bill moves on to calendar and rules. Thank you. Next item is House Bill 0867. It is rolled by 1 week. Number 3 is my bill, and we'll pass the gavel to Chairman Hill. Thank you.
Chairman, you recognize item number 3, House Bill 1198. You got a motion and a second, and an amendment. You got an amendment. Is that correct?
Let us see. Yes, sir. 4872.
We have a motion and a second on the amendment. All those in favor of adding that to the bill signify by saying aye.
Aye.
Opposed, no. Ayes have it. We're back on the bill as amended. Chairman Kumar, you're recognized.
Members, please guard yourself if you see any wood chips flying. Thank you, Mr. Chairman. In 2010, Congress enacted the Biologic Price Competition and Innovation Act to stir competition on biologics that are very expensive drugs. A biosimilar is a biological product that is highly similar to its reference product that is already approved by the FDA, and both of them are approved by the FDA for similar uses. House Bill 1198 authorized the Division of TennCare to utilize biosimilars as a cost-saving measure for pharmaceutical services. It also requires the TennCare Pharmacy Advisory Committee to consider biosimilars while making decisions regarding its recommendations. It also establishes that a health carrier may require a patient to try a biosimilar product prior to providing coverage for the equivalent branded prescription drug as part of a step therapy protocol. With that, Mr. Chairman, being a member, I think I can renew my motion.
That's right. That is correct. Thank you, Mr. Chairman. Members, any questions? I'm sorry, I have to look around a little bit. All right, we're ready to vote. Clerk, open the vote. All those in favor, hit the aye button. All those opposed, no. Any member wish to change the vote? And clerk, take the vote.
Mr. Chairman, you have 15 ayes, 0 nays.
All right, House Bill 1198 moves on to calendar and rules.
Thank you, Mr. Chairman.
Bring it.
Members, the next item is number 4, House Bill 0195 by Chairman Martin. We have a motion and a second. Mr. Chairman, you're recognized.
Thank you, sir. And we do have an amendment with the bill.
Yes. What number do you have?
5322.
That is correct. That's what I have. Members need a motion. Second on attaching Amendment 5322 to House Bill 0195. All those in favor, please say aye. Opposed? The amendment goes on the bill. Kindly explain the amended bill to us.
Thank you, Chairman and Committee. This is the Save Rural Ambulance Act that we ran a couple weeks ago. We've amended it to make it a little more clear and make sure that there's no cross-reference with other bills that are moving. As amended, this bill provides for rural emergency and non-emergency-based ground ambulance service reimbursements from TennCare at an increased rate. This moves the rate from 67% up to 78.5%. And according to TennCare, this does not impact the ambulance assessment. With that, I stand ready for question.
Well, thank you. I'm glad that any conflicts with this have been resolved thanks to legal services. Chairman Grills, you're recognized.
Thank you, Mr. Chairman, and thank you, Chairman Martin, for this piece of legislation. As a county that has a subsidy we have to pay every year for ambulance services, it's a huge burden on the taxpayers and that property tax. So I just want to tell you how much I appreciate this, and maybe getting some of the burden off of the taxpayers there and helping our ambulance services stay afloat.
Thank you, Chairman. Thank you, Chairman Grills, for that as well. My rural community, 3 different ones I represent, one of them particularly is here today, and that affects them directly. So it's subsidized by our local county, and this is just a way that we can help offset some of that cost at the state level for them.
Thank you. Any follow-up? Chairman Hale, you're recognized.
Chairman Martin, thank you so much for this bill. As I had a conversation with someone earlier about this bill, when you're in very rural Tennessee, we've got counties, one of mine don't even have a hospital, and the service that they're providing, tying up ambulances for longer times and stuff, counties are struggling, and that's running these ambulance services. So I appreciate this bill, and thank you so much.
Thank you, Chairman.
Any other questions? Seeing none, without objection, we are voting on House Bill 0195. All those in favor? Mr. Clerk, open the vote. You did. Thank you. All those in favor? Say yes. Opposed, no. Mr. Clerk, please count the vote.
Mr. Chairman, you have 15 ayes, 0 nays.
Thank you. House Bill 0195 moves on to Finance, Ways and Means. Thank you. Next item on our calendar is number 5, House Bill 0484, also by Chairman Martin. We have a motion and a second. You're recognized on this, and we have an amendment, 5211.
That is correct.
We need a motion and a second on putting the amendment on. All those in favor of attaching Amendment 5211 to House Bill 0484, please say aye. Aye. Well, kindly, okay, this is our, okay, that's fine. Voice vote is good. Amendment 5211 goes on to House Bill 0484. Mr. Chairman, explain the amended bill to us.
Thank you, Chairman and committee. The intent of this bill is to get patients across Tennessee the right treatment at the right time, timely diagnosis, and appropriate management for conditions. What this bill will do will ensure that biomarker testing is covered when ordered by a provider for the purpose of diagnosis, treatment, and management of conditions that these individuals might be facing. Similar bills like this have passed in Kansas, Oklahoma, Texas, Florida, Indiana, and this bill does not include screens, but has guardrails around what tests can be used, ensuring tests are supported by medical and scientific evidence. What a biomarker testing does, the simple explanation, it helps your cancer team find the targeted treatment that is needed for the cancer that those individuals might have. And by doing that, we can get a treatment to the patient faster, save lives, and make sure that the entire care is coordinated together. With that, I stand ready for question.
Well, thank you. Members, any questions? Chairman Grills?
Thank you, Mr. Chairman. And Chairman Martin, these markers, there are ways to have these tests outside of insurance paying for them. Is that fair?
It is fair, yes, sir. Oh, sorry.
Yeah.
Yes, sir.
So earlier this year, I went and had a calcium score. Last fall, I had a calcium score. My insurance didn't pay for it, but I thought it was advantageous for me, so I just went ahead and paid for it out of my pocket. And in the free market system, are we not moving away from that when we start mandating that the market actually has, or the free market actually has certain things that they have to encompass in those coverages?
Chairman Martin?
I could agree with that component as well, but I think when you look at it from a healthcare standpoint, when there's certain of these markers and things that they're not covering for certain purposes, then if it's the patient that we're trying to get to the bottom of, I'm in favor of making sure that they're getting what they need at the right time.
I know, I'm sorry.
Go ahead, Clay.
Well, I know your heart's in the right place, but I'm just a little bit concerned about that, and I'm just wanted to let you know where I was before I voted.
Absolutely.
Chairman Martin? Okay.
Greatly appreciate that. Yes, sir.
I think we need to make a distinction between these biomarkers if they are used for treatment and management of a disease versus screening. You know, like your calcium score was a screening test, right? Similarly, there are times these biomarkers will be used if somebody has a particular cancer, let's say whether it's breast cancer or GI cancers or colon cancer. There are biomarkers available that are part of the treatment. We are giving the person treatment. We check the biomarker, that level is going down or has not come up. That means our treatment is working. So that is part of the management and treatment of a disease versus screening. That is, I'm just worried about me having something, and I go get screening done. And in that case, insurance does not cover that normally. And again, the free market will come in. We have a right to spend the money as long as the lab would do that. Did I make that clear? I hope.
Chairman Kumar, you absolutely did make that clear, and that there's a distinction there. What are we dealing with in this bill then, Chairman Martin?
Chairman Martin?
It's helping cover those services that aren't covered by insurance. So if those aren't covered services, it's helping get those covered for them.
So are we dealing with the treatment, or are we dealing with the screening?
This is portion of it is dealing with making sure that the test is supported, evidence-based of the test. So it would be on the testing side of it.
So it would be treatment.
Treatment side, yep.
Yeah, because screening is too wide a matter, and there was a number branded around. I couldn't believe it, but there are more than 2,600 or 26,000 tests and so on available for screening. We can screen for everything, but insurance cannot possibly cover that.
Thank you so much for that explanation and clearing things up for me.
All right. Any other questions, members? Oh, Representative Freeman, you're recognized.
Thank you, Chairman, and thank you for addressing that. That was part of what I was going to point out. And to the sponsor, thank you again for bringing this bill. Many of you have heard multiple times me tell my story with the cancer scare in our family, and I truly don't believe that my wife would be here today if not for these biomarker screenings. And for us to be able to go in and find out exactly what needed to be done. I think back to the free market example my colleague just said, I would actually make the statement that it would save us money, that we're not guessing on 17 different treatments and yada, 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 that we know exactly what it is. And my seatmate here and I were just talking earlier, after her biomarker screening, we got an actual game plan that showed us what steps we were going to do based on the screen as it came back, and it was so prescriptive. Anyway, this is a great bill, and I think something that I think insurance companies should cover. I know they don't want to, and I don't know why they don't want to, but I think they should. So thank you.
Thank you, Chairman.
Any other remarks? Give me a moment, Chairman Speaker, just to clarify or just to add to what Representative Freeman said. Insurance companies do cover biomarker testing in the course of after a cancer is diagnosed, the tissue is analyzed or blood tests are taken, and that tells us which biomarkers are there, various hormones and so on. And drugs can be selected more precisely. That's there. On the other hand, like colon cancer, we can have a biomarker that we check before. Let us say the number is 44. We do the surgery, remove it. The number should be 0. If it's not, that means there is some cancer left in the body. And if it is 0, then every 6 months or so we can check it. If that number is rising, that means the cancer has come back, and we need to look for where it is. So, and those things are routinely covered by insurance. It is just screening tests that are not, and because of just the expense, and one needs justification for spending insurance and insurance payers or members' money, really. Are you okay with my explanation?
I think so, but I just, again, find it interesting that members of the Insurance Committee have been actively working against this bill as opposed to advocating for it. And so that's my only point. So
Yeah, well, we are a free country. Chairman Speaker, you're recognized.
Thank you, Mr. Chairman. Can you, and I'm trying to get my head around this, and Chairman Kumar, you may be able to chime in on this. So what is the process for these screenings? Is it like during a physical, I go in for a physical, and then the doctor prescribes a biomarker test looking for things, or how does that work? I mean, and in relationship to your bill, in the process, where's all that flow into?
Well, Chairman can answer that one more directly than I.
Thank you for the question. It's more of a question in practice of medicine. Again, the scenario will be a particular type of cancer for which a biomarker is known to happen, or a patient with symptoms and laboratory data and x-rays that point to the fact that this could be pancreatic cancer. Now, you can do biomarker testing, which is justifiable because there is x-rays, evidence, and patient symptoms pointing you towards that direction. So then you can do biomarker testing for pancreatic cancer, CA119 and so on, that if that is high, then that will say, yes, it is corroborative evidence that that is exactly what's happening. That is, again, diagnosis and treatment and not screening. Screening would be there are no symptoms or anything, but let's say there is a strong family history or a particular age and one is concerned about cancer. And yet, in case of prostate cancer being so common with age, insurance does pay for it, although that is screening. So there are situations that screening tests are also paid, but most of the time there has to be justification for the test, either family history, symptoms, or other things that point towards that direction.
Thank you.
It's really good there's no doctor here to dispute me. Dr. Terry is too kind. Chairman Sparks?
You know, I don't think we really have that many experts, even in this room, on this subject. But I'm reminded of an ounce of prevention is worth a pound of cure. And just get down some common sense. And I love the free market. I love it. Sadly, it doesn't apply when it comes to health care. Let's just be real. It doesn't apply when it comes to drug cost. We pay the highest in the world, so free market's not there for that. I know my wife's been affected. They kind of keep an eye on her, and we're seeing the rise of cancer rates among every cancer that I know of is increasing. So it gets back to seem like it's almost like an investment. If I know, an ounce of prevention is worth a pound of cure. So appreciate you bringing this piece of legislation. I plan on supporting it. Thank you.
Well, thank you, Chairman Martin. Members, are we ready to vote? Without objection, we are voting on House Bill 0484. Mr. Clerk, please open the vote. All those in favor, please vote yes. Opposed, no. Mr. Clerk, please count the vote.
Mr. Chairman, you have 16 ayes, 1 nay.
Thank you. House Bill 0484 moves on to GovOps Committee. Thank you. Next item is item number 6, House Bill 0296 by Representative Love.
Motion.
We have a motion and a second. Representative Love, you recognize we have 2 amendments. Which one are we running?
Mr. Chairman, we have I apologize. I had this one traveling from subcommittee. 004900.
Yes. And that amendment that followed that is 4928. You just want to run 04900?
Yes, sir. I think 4928. Yes, sir. That creates the study.
Thank you. We have a clarification for you. The First Amendment makes the bill, and Second Amendment moves the date of
Right.
application.
Okay.
Thanks to our legal services. Members, we need a motion and second to attach both amendments, 4900 and 4928. Can we, one at a time? Okay. I stand corrected. We will attach Amendment 04900 to House Bill 296. Can I have a motion and a second? We do that, and all those in favor, please say aye. Opposed? None. Amendment 4900 goes on to House Bill 0296. If you please, let us also handle the Second Amendment, and that is 04928. Need a motion and a second. We are attaching Amendment 4928 to House Bill 0296. All those in favor, please say aye. Opposed? Amendment goes on the bill. Representative Love, explain the amended bill to us.
Thank you, Mr. Chairman and committee members. House Bill 0296 seeks to address an issue that many of our children suffer from, and that is the need for speech therapy. Children who have issues related to stuttering or stammering or have other speech deficiencies oftentimes have also low self-esteem because of the inability to communicate. I myself, people think that I talk slow for dramatic effect, but the truth of the matter is I have speech problems as well, and I have to make sure that I go through a process of slowing down and letting my words come out carefully. For those who would stop by Lee Chapel on any Sunday morning, as excited as I am preaching, you may see my wife on the front row saying to me, slow down, because I get excited and the words get jumbled. And so I know many kids suffer from the same thing, and this would simply have a study done by TASER to look at the benefits and the feasibility of implementing the potential effects of enacting the insurance coverage requirements proposed to provide speech therapy for students. That, Mr. Chairman and members, is the bill.
Well, thank you for that explanation. Chairman Martin, you recognize.
Thank you, Representative Love, for this bill. I had an individual from my district come. She runs a speech clinic there, and she explained to me, especially I didn't think about the impacts on our children's aspect and the mental health component of what stuttering does at that early age. She was addressing it the very early component, and it really opened my eyes to what that was doing. And to hear your story as well is encouraging. But thank you for bringing this, and we can look into it. I'm excited. Thank you.
Thank you.
This is incredibly important because it affects the personality, mental health, and a person's ability about how they're perceived. So I think speech therapy can be corrective and would be very useful. Although when you talk slow, I thought you were just a Southerner.
No.
Do we have any questions? Seeing none, and without objection, members, we are voting on House Bill 0296. All those in favor, Mr. Clerk, please open the vote. All those in favor, please vote yes. Opposed, no. Mr. Clerk, please count the vote.
Mr. Chairman, you have 17 ayes, 0 noes.
Thank you. House Bill 0296 moves on to Finance, Ways and Means. Item
Mr.
7
Chairman,
on
committee
our
members.
agenda is House Bill 0015 by Representative Love. We have a motion and second. We don't have any amendments. You're recognized on House Bill 0015.
Thank you, Mr. Chairman and committee members. Many of you know my long, extensive work on sickle cell and efforts to try to make sure that persons in our state get coverage and get the treatments that they need. And just want to acknowledge, Mr. Chairman, that a bill we passed out of the General Assembly a few years back, the sickle cell study bill, has now been duplicated in 31 other states as I see the need for that. However, I know there's some work that still needs to be done on this, and I'm going to ask we roll this to the first calendar of next year. I've been in talks with the Department of Health about a particular person they have now assigned to work with sickle cell. And Chairman Hill and I talked about if we can maybe get some answers from them on ways to help the 306 persons who aren't covered by TennCare now. There may not be a need for this bill. So with that, Mr. Chairman, I'd like to request this gets rolled to the first calendar of next year.
Well, thank you. This is also a very important effort, and there are exciting new developments in treatment of sickle cell disease. Without objection, we are rolling House Bill 0015 to next year's calendar. The last item on our agenda is House Bill 8, number 8, House Bill 0295. We have a motion and a second. We have 3 amendments. Which ones do you plan to run?
Mr. Chairman, we are, let me get my numbers here right. I think we're looking at the last one, which I think there's 2 going on. Is that right? Just one?
The last one. Okay, I'm told that the appropriate amendment to attach will be 04668.
Okay.
Well, thank you. Members, may I have a motion and a second to attach? We are attaching Amendment 4668 to House Bill 295. All those in favor, please say aye. Opposed? Amendment goes on the bill. Representative Love, kindly explain the amended bill to us.
Thank you. And that amendment includes the date change. Is that correct?
Do we need to go out of session? Okay.
Okay. All right. Thank you very much, Mr. Chairman, committee members. In 2022, the General Assembly passed House Bill 2109, which later became Public Chapter 1108. This law required the Department of Health to collaborate with the Bureau of TennCare to study existing doula certification programs in an effort to see what the pathway to certification in Tennessee would look like. In 2023, the General Assembly passed House Bill 0738, which later became Public Chapter 424. This law created the Doula Services Advisory Committee to advise the department on establishing core competencies and standards for providing doula services. And House Bill 0295 is the next step in a process that was designed to provide more opportunities for doula providers with particular emphasis on insurance reimbursement. I will say this, Mr. Chairman and committee members. In my 13 years of legislating, this has been one of the most engaging bills I've proposed. There has been a lot of misinformation. I've read the emails that you have read. And unfortunately, also the tone of disagreements has, from what I've seen, some text messages being sent to some folks, some things being said about people when we all are trying to get to the best solution. So I want to read to you from the report that was voted on by the Doula Advisory Board. It says that they recommend that doulas who do not choose to work with TennCare or other health insurance plans, hear me carefully, are not required to go through the verification process as they've been verified through their certifying body. The committee recommends that if there are fees associated with applying to be verified, a fee waiver could be created for doulas in economic hardship. In other words, there are two paths. For those who want to apply, again, for insurance coverage, go through the verification process. For those who don't, then keep practicing as you are currently. And if there is a demonstrated economic hardship of not being able to pay the $400 to be verified, in the report, they recommend a waiver for economic hardship. So I know there have been emails, and I know this is a very sensitive subject because some people think that this is an effort for control and restriction. But the path was always leading up to this if you wanted to be reimbursed by insurance. And anyone who's legislated any amount of time knows sometimes it's a multiple step process. You got to build upon success from the past and increase your success. If you find issues, you put in amendments. And I've told some folks in conversation that the belief that hospitals will restrict them because they don't have verification, if that becomes the case, I'm willing to work with them to alleviate that problem. But I also think, Mr. Chairman, there are folks that testify on both sides of the issue, so I'm open now for us to go out of session to hear those persons.
Well, thank you. We are going to go out of session. We have 3 people who want to testify. We will do that. And thank you. I mean, the goal is good, but there is discord along the way. And maybe we can find harmony for accomplishing the goal that is helping pregnant ladies go through difficult times. Without objection, we'll go out of session. I have 3 people who wish to testify. First is Ms. Angela Williams. Ms. Williams, pick a chair, and thank you for coming. The light around your mic is red, so it is on. Kindly identify yourself and tell us who you're with. You have 3 minutes.
I am Angela Williams, and I'm a private citizen, resident of Nashville.
Go ahead.
Sorry. Okay. So I'm here to speak, and I'm speaking as a public health advocate and private citizen concerned about families' access to supportive services during childbirth and postpartum period. I ask that you give House Bill 295 full and fair consideration. I believe this bill serves as a precursor to doula care during families' most vulnerable times. Doula support maternal and infant vitality. Doula care saves lives and reduces healthcare costs. Allowing this bill to pass and widen access to families with limited to no social supports to have support, therefore I believe it's understanding the bill that will help clarify concerns that may be raised here. I understand the bill to establish a verification process that checks verification of doula certification to ensure doulas meet the needed competencies to serve families. It's also my understanding that this bill will be informed by a Doula Services Advisory Committee, which was purposed to provide recommendations that will inform the process. I understand this process to be voluntary, similar to an already established process for verification midwives in Tennessee. Midwives in Tennessee who choose to receive reimbursement from TennCare, there are currently practicing midwives in this state that choose to participate and some do not. It is also my understanding that it is and would be insurance payers' due diligence to ensure patients are receiving care from trained professionals. Thank you.
Thank you. Members, do we have any questions for Ms. Williams? Seeing none, Ms. Williams, thank you for coming.
Thank you.
Next, we have Ms. Rebecca Porter. Ms. Porter, thank you for coming. Your mic is on. Kindly state your name and tell us who you're with, and you have 3 minutes.
Thank you. My name is Rebecca Porter. Thank you guys for letting me be here today. I'm a state licensed massage therapist. I'm a mom of 10 kids. I am a doula. I've been a doula for 30 years. I'm currently the president of the Tennessee Doulas Association as well, which is a nonprofit statewide organization. And I'm here today to talk about this bill because it's had a lot of different confusing points to us as we've tried to figure out different things. And it's been concerning for us because even as we've voiced our concern and met with different people, we've actually been having different issues of people reaching out to us, even threatening jobs and things because we want to oppose this bill as we've tried to reach for clarification. So a couple of things that we wanted to point out was just kind of why, who's pushing this bill when we as doulas aren't pushing it, and why would we get threatened over having any kind of opposition that we want just clarification. And so we do believe in equitable access to doula care. It's critical, but we think that how this is going about, we don't agree with. Verification is necessary, as in the TennCare legislation, and we do agree with verification, but only one state actually has a state doula board, and that's Arizona. All the other states have chosen to have a verification process, even handled by an outside company. The Doula Network is one of those examples in a lot of the southern states as handling that as well. So there's another option than having a state board. Our other point is that fee is actually financial hardship. I've talked to a lot of fellow doulas that even if they wanted to serve that TennCare population, having a state fee would be a limit to their profession and they would stop doing their work. So it would be a hardship to them. You might not know, but we don't make a lot as doulas, and so having a fee to serve this population is hard. We're currently running one of the pilot programs. We've served 84 moms in this TennCare program, in our pilot program, and it's been a very big learning experience. It's been hard for our doulas and hard for us to run it. We also want to say that let's think about this. If we're putting in a bill that has to do with the recommendations from the Doula Services Advisory Committee, have you guys read those suggestions from that committee yet? I attended all those different committees meetings, and I will say that they also did not recommend a board to be used for that verification process. So just please consider that there are other ways to go about this, like the other states have done, that doesn't need a state board, that you could do a verification process, that the state has mandated the credentials or the competencies that the doulas have to know, but it doesn't have to be run in this manner per our research in talking to TennCare as well and other insurances. I'm currently a doula through TRICARE, and I don't go through a state board, and I do get reimbursed by TRICARE insurance currently to serve military families. So thank you guys for letting me come today. I'm here to answer any questions you have.
Well, thank you for coming. Members, do we have any questions? Just to ask you, said you have been a doula for 35 years or 30? 30 years. And what was your certification process? Are you certified by anybody?
Yes, I am. For a while, I was not certified. I just worked like most of us doulas start, just by helping. We give birth and we want to make birth better. I watched my friends have poor experiences and I wanted to make a difference. And so as I did that work for several years, I then decided to get certified. The hard thing is I certified through DONA, a great organization, but it cost me over $1,200 and took 3 years. Not everybody can afford that in time and costs.
Okay. And how did you happen to connect with TRICARE for them to recognize you as a provider?
Yes. So a couple of years ago, that was put out that TRICARE would cover doulas, but they picked 5 programs that you had to be one of those to be a TRICARE provider. And then they had somebody that helped anybody on board. And so they had a portal. I'm a provider through their portal. And I just went on board and I uploaded the different credentials that they asked for TRICARE, like having CPR certification. I had to prove that I was a certified DONA member and those kind of things. And once that was cleared through the portal, then they sent me a letter and I could start taking clients and get reimbursed.
Thank you. Who is or what is DONA? Can you define?
I'm sorry. Doula, okay, I got to think. That's a hard question. Doulas of North America, thank you very much. Stressful, forget. But they're an international doula certification program. They are the oldest doula certification program. They helped put the word doula in the dictionary, and they've been around for about 25 years.
And what was your qualifications to be certified? Did you undergo training that was required by DONA?
Yes, so DONA, I had to go to a 3-day training. We had to do breastfeeding education as part of that. And then after that 3-day training, I had multiple steps I had to do post that. It took me 3 years to finish, in which I had to serve 3 clients. One of them could be a C-section. The other had to be a vaginal birth. I had to get testimony from the people I served. I had to read books. I had to write essays. There's a lot that went into that through the years. And the hardest part was getting the 3 births certified, because so many ended in C-sections, and they had to have at least 2 of them be vaginal births. And I had a certain number of hours I had to support them in the labor.
Well, thank you. Chairman Speaker, you're recognized. Okay. Also, we have Representative Parkinson.
Thank you, Mr. Chair. You had mentioned the fees. I was a little bit confused about what you were saying about the fees.
Go ahead, you're recognized.
Which fees did you mean? Are you talking about doula board fees or my fees for DONA certification?
I think under the fees under this legislation.
Right. Sorry.
Go ahead.
Sorry.
It's okay.
New to this. So in order to create a state board, we've been told that it has to be funded, right? Self-funded. And so in the fiscal note, it says it's assumed that the certification fees for doula providers will be set at an amount sufficient to cover an increase in expenditures. So if they create a state board, there are state fees. As a massage therapist, I am part of that board, and I have to pay fees to be part of that massage board. And then I have to do recertifications every 2 years. So I have to pay for the certification classes and resubmit that and pay fees again. And so we know there will be fees associated with the board. And we've been told it's $400, but we don't have anything in writing with that. And that's part of the concern is, what is that number? What does it look like? How will it affect us? And even talking to doulas across the state, how many would want to be part of a board? If it was voluntary, we might have 20, maybe 50. The majority do not want to be part of a board.
Gotcha. And let me say this before I continue. You know, I truly appreciate all the work that doulas do. I do the largest community baby shower in the Memphis area, and we have doulas that come and speak and educate and help with the new and expecting moms at the baby shower. I do have so. In regards to the fees, and this is based on what the legislation is saying. You don't have to pay the fee though, right? If you choose not to, right? You can still be a doula.
Okay. You're recognized.
Oh, sorry. That's what I've heard. We were trying to get clarification on this. The only problem is if I have my community doulas who want to serve TennCare clientele and get reimbursed, they would have to pay the fees. Now I've heard something about a voucher. That's the first time we've heard that part of it, but they would have to pay the fees.
Right, but based on what my colleague said, you don't have to pay the fee if you don't want to be reimbursed by through TennCare. And so I think it's a decision that the individual is up to the individual to make as to whether or not they want to pay the fee or not, correct? Based on what the bill sponsor said.
You're recognized.
That is what we've been trying to get clarification for, because it has been confusing, because the verbiage here doesn't say, and that's where we were just trying to figure out what is the intention of the bill. If the intention is to make doulas certify with the state, if the intention is to make everyone funnel in, that is part of the concern. If that's not the intention, great. I'm just curious how you would fund a board with these fees and only have 50 doulas that are part of it.
Right. And so, you know, I was pretty clear on what he said, what the sponsor said, that, you know, is you can pay the fee or not pay the fee. And if you want it to be verified to be able to be reimbursed through TennCare, you pay the fee. If you don't want to, you don't pay the fee. And so that leaves it completely up to those individuals how they want to continue in their practice. But I do want to ask you this though: you had to verify for your credentials, didn't you?
Correct.
Right.
Oh, sorry.
No, go ahead.
Sorry.
I'm sorry.
He's not following that, so I think you can also.
Sorry, Mr. Chair.
But you recognize. Kindly go ahead.
Sorry. Correct.
Right, and so I'm just trying to understand. You know, if you had to verify, but are you saying you're against the bill for others being verified or becoming verified?
You recognize.
So I just want to delineate. There's a difference between certification and verification, and that's part of the verbiage of this bill. What is meant here? Certification. I don't get verified for Idona. They don't do a background check on me. They don't verify I'm real and not AI. They just ask me to send in my things, and then they check to see that it's been completed. And they give me a certification that's recognized internationally.
Right.
The state, if they do a state board, are they talking about certification or verification? Verification is different. If you want to check in to see, did I complete competencies, information, etc., I understand that. But this would mean I would still have to do my certification and recertification with my DONA group, and on top, I would have to also do this to serve the TennCare population. And if I have a doula who already has problems making ends meet, because most of my doulas struggle to pay their bills, pay their rent, pay their gas. And so, yes, it sounds like a small fee, but if they wanted to serve this population, they're going to have to come up with $400 or more. They might not have that to begin with.
Right, but you came up with $1,200, right? And let me just finish this question. You paid $1,200 for your certification, right? This is saying for those that choose, they will pay $400 to be able to service TennCare recipients and possibly get reimbursed for it. You know, and so you had to verify your credentials in order to get that certification. Am I correct? You had to, did they not verify your credentials? Because you said earlier in your testimony that they asked for this, that, and the other to make sure that you had done all of the things that you had to do to.
You recognize the last question.
In the sense, did I have to turn things into my organization? Yes, they trained me. I turned things into them.
Okay.
Is that what you're asking?
I think I am. I think it's the same thing, though, and I think it's the same thing that they're asking in this bill. You know, that individuals, verified just like you were verified, but just this time through the state or through whatever organization it is. I don't even think it's a board. Is it even a board? And maybe that's for the sponsor, Mr. Chair. And but thank you. I appreciate
Thank you, Representative Parkinson. Thank you, sir. Chairman Hale, you recognize.
You know, as I heard you speak, and I've heard the questions with Representative Parkinson there. So if there's a waiver, as the sponsor said, then for hardships, then that removes that issue. And then another thing that I don't understand is there's some of us on this committee that are professionals and are member of different associations, but yet we have a state verification. And as this, the summary of this says, that the Department of Health issues verification of certification. So what would be wrong with a unified, rather than if you're a member of one association and another doula is a member of another association and their certifications and things are totally different? This brings it into a more unified, and if you're going to be receiving taxpayer dollars, what's wrong with being certified to receive those dollars? And if there's a waiver to help with that fee, then I don't understand the issues here.
Ms. Porter?
So I heard this statement. I guess part of it, Representative Hale is asking, what's the question? Are you saying, why are we opposed to that?
Yes.
So you're asking about why are we opposed to a verification process, or just bringing people together? I kind of got lost in the question a little bit, if you don't mind restating.
Chairman Hale?
So you're talking about you're certified under DONA, I think is what you said. But then another doula may be certified under another organization or association. But if we have a state certification process that you go through, then everybody's under the same certification rather than different certifications. Why do you have a problem with that? Because that's a part of what this does.
Right. Oh, sorry.
Go ahead, Ms. Porter.
Sorry. So the problem is not having us all have the same competencies. I agree with that. There are over 100 different organizations that train doulas. And when we look at other states, some of them have chosen to pick to go through certain programs. You can, like TRICARE says, you can only be one of these six programs. And if you're not a certified doula through these programs, you can't serve these military personnel. So some of the states have looked at that concept. Other ones have looked at just competencies. And so competencies, you're right. I'm all for bringing the competencies. Like, do the doulas know this information? Because you want to make sure for public health that they know some basic things like anatomy. They know what's happening in the hospital, those kind of things. So yes, I see your view on that. And yes, that's great. It will mean that we will have our fees for our own certifications that we already carry. In addition, we'll also have the state. And then you talk about having the vouchers. Well, what's the information on that? Who gets a voucher? Does that affect everybody? Where is that parameter? Is it based on income? Is it based on whoever wants a voucher? There's just a lot of unknowns in this that we're just voicing concerns that we don't have enough clarity in the plan to feel like there's a definite plan. But we understand verification. Insurance needs to do that, due diligence. That's why you guys are here, to make sure that taxpayers' money is spent well to support people and that nobody's frauding. I totally get that. But then just thinking about how that's done, how that's laid out, what does that mean? There's still some questions to this that aren't clear. And that's where the doulas are voicing their concern of the hardship. Would they even qualify for that voucher? What would that look like? Who does that affect? We just don't know those answers. This is the first time I've heard about the voucher idea. And so we are for competency checks, yes. We are for TennCare and other insurances covering doulas, yes. And for doulas choosing whether they want to have their own clients and or serve through an insurance, great. Would a state board affect that? That has been part of our question. And so we don't need a certification and erase our current certification programs. We will still do those, and on top do this state one as well, is what it would end up being. And what does that process look like? We don't have an answer for that either. And many states are finding they need to be careful and have revised what they're doing because they're not having a lot of doulas come in and participate in the program because they made so many barriers to coming and participate, even getting access to get that voucher to be part of that. How many barriers are going to be in place for that? We don't have answers for that, so I don't know.
Thank you, Ms. Porter. Were you a part of the Doula Advisory Committee?
I was not. There were only 2 doulas active on that. Well, quite a few. That's a long story. But yes, I was attending, but I was not part of that committee.
And did you say there were only 2 doulas on the committee?
Technically, it started with 3. We lost one last January. She was replaced this summer. We lost another one last May. She was also replaced in October. She did not attend the meetings. There's only been 1 doula who lives in North Carolina who's been on all the committee meetings.
Well, yeah, I guess, thank you for informing us and enlightening us. Thank you for coming. We appreciate it. Thanks a lot. Members, in all fairness, we do have a third person that would like to testify. That is Miss Angela Mitchell-Hill. Ms. Hill, your mic is on. Kindly state your name and identify who you're with, and you have 3 minutes.
Hello, my name is Angela Mitchell-Hill, and I am a Tennessee resident, so I'm representing myself. I am a doula as well. I am a doula and a perinatal patient navigator. I do want to say that. I'm a community-based doula. Today, I stand before you in neutrality, not in opposition and not in full support, but committed to alignment for this bill. Because this is not about division. This is about ensuring that policy and the doula community in Tennessee move forward together to improve maternal health in our state. I want to first stop and express my sincere gratitude to Senator Lamar and Representative Love for their efforts to bring these bills forward and the work that has already gone forth to again help save lives in Tennessee. Their leadership acknowledges what we all know to be true, that doulas do really have magic. That, I don't want to restate all of the statistics that prove that doulas have magic, but the data is clear. When a doula is present, outcomes are improved. Fewer medical interventions, healthier mothers, healthier babies, stronger families, and yes, even cost saving for our healthcare system and our state. But for this magic to continue, in my opinion, policy is necessary, and the policy should align with the practice of being a doula. If we want to move from the 47th state in the nation to number 1, we should stop and look at the whole picture, the families, the birthing parents, the hospitals, the insurance companies, the doulas, and yes, the state. Doulas, we deserve policies that protect our role and uplift our profession and ensure that we do earn livable wages. That is very important. And we cannot improve maternal health if doulas, who are on the front line of this work, are struggling to sustain themselves and their families. So again, I believe that policy and alignment with doula services is necessary.
Thank you, Ms. Hill. Your time is up. If you have a last thought, you're welcome to state that.
I just believe, they call me doula of dreams, and I just believe that dreams don't just stay dreams, that they become reality when we work together and align policy with the practice.
Thank you, Ms. Hill. Members, do we have any questions for Ms. Hill? Representative Parkinson, you're welcome, but kindly allow me to sort of referee the debate, okay?
Allow you to what? I didn't hear, I'm sorry, I didn't hear what you
To control the debate.
said. Yes, oh, absolutely. Thank you, Mr. Chair. Yeah, I don't want to debate anyway, Mr. Chair. I do want to say this, that Memphis and Shelby County had such a high infant mortality rate that it was compared to that of a third world country. And it speaks to the importance of your role. And I appreciate everything that you were saying. I actually want to give you more time to say what else you had to say, right? And I appreciate the smile now on your face because you look like we were going to war for a second there. But yeah, you know, and so you know the role of the doula in Memphis and Shelby County is paramount. And you know, under this legislation, and you correct me if I'm wrong, I feel like you know because this is something that comes up in the Fresh Starts Community Baby Shower. Shameless plug. One of the things that comes up every single year is are doulas affordable? You know, to the women that we serve at the community baby shower, and it's a large baby shower. We have 500 women in attendance, but one of the things when the doulas get up and speak and talk about the services that they offer, you know, is can we afford to pay for the services? And if I'm not correct, and you correct me if I'm wrong, wouldn't this, especially if they are able to be reimbursed by TennCare, wouldn't this help make it more affordable for those mothers that are struggling to try to pay for those services?
Yes, I agree. I agree that, you know, listening
I think
to...
you're supposed to wait for
I'm
him.
sorry.
That's okay, Ms. Hill. Go ahead, Ms. Hill.
Yes, I agree. And listening to the report being read today definitely shines new light. And with the ability for the hardship allotment for those of us that can't, you know, afford, and also the choice for doulas that don't want to go through the verification. I think that all of those are right on par. I also love the fact that there has been clarity brought to certification and verification of certification, because those two things have been intertwined and in my experience caused division. But we're speaking, to my understanding, listening, we're speaking about verification of certification on a state level in order to qualify to receive insurance reimbursement by choice. And for that, I support that.
Thank you. Representative Parkinson.
Thank you, Mr. Chair. I just want to say thank you, and again, you know, I truly appreciate, you know, all of the stuff that you all do, you know, in helping our new and expecting mothers. Truly appreciate it. Thank you, Mr. Chair.
Thank you, Ms. Hill. Members, if you have a question, Chairman Lafferty.
Yeah, please. Thank you, Chairman. And I'm just curious, and it may have been said earlier, how much outside of insurance, regular, real world, what does a doula charge? Is it by the hour? Is it by the delivery? And the reason that I ask, we've probably all had ladies in our lives that have had long, excruciating births. And then I've got a friend of mine that by her fourth child, I think she drove herself in and was home by lunch. So just please, if you could.
Yeah, and I'll just speak from my personal experience. Doulas in this area, per family is, or per birth is how it's billed, and that includes, you know, some mothers you meet at 6 weeks, some mothers you meet at 8 months. The fee doesn't change where we meet them at that point because we still offer the same level of care. And so that amount is anywhere between $900 and $1,300, $1,400 is what I have experienced.
Chairman Lafferty.
Is that for a day, or is that for a relationship, as you've just described, that could cover months?
That's for the relationship, and I'm glad that you asked that, because we're talking about livable wages for very important people. And if you think about what a $1,200 payment equals when you're working with a family for 7 months and 6 weeks after. So when you take that number and break it down, you know, how much was actually made by the doula. Doulas we work for passion, out of passion. We love what we do. We love the communities that we serve. We love the impact that we make. And so, again, having a bill to go forth to create opportunity for access to livable wages is, I believe, beneficial for our doula community as an option, not as something that's mandatory.
Thank you for that. Thank you, Chairman.
All right. Seeing no other questions, Ms. Hill, thank you very much. We really appreciate your input. Thank you. Members, we'll go back into session. Do we have any questions for Representative Love? Representative Love? Representative Hakeem?
Thank you, Mr. Chairman. Representative Love, well, firstly, the report that you spoke of, and I think in that report there were items that maybe not only myself but others had not heard before. Could you delineate those to me again?
Sure.
Representative Love?
Thank you, Mr. Chairman. Sorry. And much of it has been said by those who spoke. There was a great deal of concern because the initial term used was state certification. And that concern brought about the use of the word verification. And in the last meeting Thursday, I was on there the whole time as they painstakingly went through and changed where it was certification to verification to allow those who have certification to understand the state's not supplanting your certification, but they just want to verify your certification. Second thing is that, as I read to you from the report, that the committee recommended that the pathway to verification leads to reimbursement for the services through insurance. If you don't want to go the pathway of having TennCare be the reimbursement or paying vehicle, then keep doing what you're doing and don't go through the verification process. And so I would almost say a dual path, an option to say, if you say, you know what, I'm concerned about the $400 fee, and my clientele is not paying through insurance anyway, this does not affect you. If, however, you recognize that there may be a population out there of TennCare persons who may need your services, then the pathway to that is through verification of your certification. And if I could, Mr. Chairman, enlighten members, I'm sorry, I've watched my tones here, inform members about the fact that one of the bills I brought a few years back, creating the Maternal Mortality Review Board, the last report from 2024 says that those with less education, those with TennCare coverage experience higher rates of death. Say that again. The Maternal Mortality Review Board report from this past year said that those with less education and with TennCare coverage experience higher rates of pregnancy-related deaths compared to their counterparts. So this is not the only solution to that, but it makes sense to me that if we say that we have a higher rate of pregnancy-related deaths with those who have TennCare coverage, and they cannot pay for the doula services, how about have a pathway to have doulas see the TennCare patients? But what must we do? Oh, we got to have verification. Because you got to get verified in order to have TennCare reimbursed. So is it the solution to all of it? No, but I think it's one of the solutions we can use because I've watched these numbers be very disturbing. 76% of the deaths could have been prevented. The first report said 85% could have been prevented. So for me, this makes sense as they've all testified to the fact that their work is magic. It helps. It helps women go through this process and make it. And if you don't want to go through the verification process, if you feel like maybe it's just too much, you can still keep helping women with this process that you're already doing.
Thank you, Chairman Hakim.
Thank you. Oh, thank you, sir.
You're welcome.
Oh, Chairman. Okay. Thank you for that, Rep. It gives me more clarity. And one thing that I guess I wouldn't say I overlooked it, but sometimes with our bills, we don't, it takes time, so to speak, sometime in the legislature to make changes along the way as opposed to trying to get it all at one time. Give people an opportunity to see what works, get a better understanding and appreciation of the need or the access to this health care. I did come today with great reservations, but I did listen to, now that report you gave, those recommendations, is that to be a part of this piece of legislation, or is that something that has to go forward?
Yes, it's part of that. And just for clarity for those in the community who have questions, concerns, I always try to make sure that I don't have conversation with people who don't do what we do, assuming that you understand when we say things like, in addition to rules promulgated, pursuant to subsection B, the commissioner shall promulgate rules to effectuate this section, included but not limited to rules for the collection of fees and rules regarding the imposition of discipline, including the assessment and collection of fines. Whenever we say to departments, right, promulgate rules, we're saying to them, as much you can tell us, answer those questions. And so I don't want members to think that we're just throwing words out, but this is the language we use. It's some things I'm sure, and I'm sorry for talking, that we don't understand, but it's what you do. And so I just want to answer that question that way.
Representative Lau, just a couple of things. Did the members receive a copy of the advisory committee report?
The members have not. It is still being tweaked for grammatical errors.
Okay, so they have not, members have not received the report of the advisory committee because, you know, decision making is based on that. Also, the other concern that became apparent was that the advisory committee was one person stayed all along, and then there were two and one and so forth changed around. So there is concern about the advisory committee report, and the members having not received it, it would be, I guess the members should tell us if it's fair to ask them to vote. Also, the qualifications for doula that I see in the advisory committee report are, would you say it's work still in progress, or is it complete?
The qualifications?
Right, listed in the advisory committee report.
I would say it's complete. The report was adopted by the committee last Thursday.
By which committee? The advisory committee?
Yes.
Okay. They are the ones who prepared the report.
Correct.
Okay. Chairman Speaker.
Thank you, Mr. Chairman. I've learned more about doulas in the last 2 weeks. I could probably, maybe with a certification, become one pretty quickly here. So all I do is I look at the language that you've put forth to the committee. That's what I want to do, okay? We've talked about TennCare. I'm trying to find in the language of the bill that TennCare requires this board to be created so that these individuals can get reimbursed through TennCare. Can you direct me to that section of the bill?
Representative Love?
There is no section in the bill that says that TennCare requires this for reimbursement.
Fair enough.
Chairman speaking.
Okay, fair enough. Doulas are the services that doulas provide currently is not reimbursable through TennCare. Is that an honest
Representative Love?
statement?
Correct.
So this would be expanding our TennCare program to allow something new that wasn't normally approved through TennCare. Is that correct?
Representative Love.
The coverage of doulas.
You're saying, would it be expanding TennCare to provide coverage? Well, no, because the person already on TennCare.
This bill does not do that.
That's why I said it doesn't. The person already on TennCare. It does not expand the TennCare roles. It does not expand the number of people covered by TennCare. These persons are already on TennCare, that not the doulas, but the pregnant women. Yeah.
Chairman speaking.
So the question I had was, doulas currently are not able to be reimbursed through TennCare for their services.
Correct.
If it is required by TennCare for them to go through some kind of board or whatever it is to be reimbursed, now doulas would be added to a service that TennCare would be providing to pregnant women on TennCare. Therefore, doulas would be added to the TennCare availability, which would expand that program.
That's my understanding.
Okay. One more, Mr. Chairman.
You're recognized.
I'm reading through the bill. The words are important. Is from listening to what the doulas have been, I'm sorry, my time's run out. Oh, sorry.
Go ahead.
From speaking with the doulas in my office, the numerous times they've come in to explain in detail exactly what they do and how they're certified, looking at the language in the bill about, number one, understanding anatomy, number two, number three, these are all things that they are already doing to be able to be doulas, to understand how to help these women. If they're already able to do this, in your bill, if they don't want to be certified by the state, because it talks about certification of the state, if they don't want to get certified, are they still able to be doulas in the state of Tennessee? And the reason why I ask that is...
Yes, sir.
The reason why I ask that is, in the advisory committee report, it makes that unclear. It makes it assume that able to be a doula in the state of Tennessee, you have to go through the certification process of the board. So I like clarification, because I don't want to hamstring us here.
I'll read to you from page 12, and I'll hold it up as much as I can for you to see it, but I can't show it all to you. All right. The committee recommends that there...
Excuse me, Representative.
I'm sorry.
Did you say page 12?
I'm sorry, page 14. I apologize, page 14.
But we only have... Oh, this is a summary of the report. Okay, I thought we have only 2 pages.
I got.
So you gave us a summary, but you have not given us the entire report.
Yes, sir. But I'm reading to you from the report.
Okay.
Page 14 under verification, not certification, verification process. The committee recommends that doulas who do not choose to work with TennCare or other health insurance plans are not required to go through the verifying process as they have been verified through their certifying body. Now,
Representative Love, it's difficult to make a decision if members have not received the report. Wouldn't you agree with that?
well, Mr. Chair, I would.
But that's not what the language.
Chairman speaking.
I would say this.
Excuse me. Go ahead.
I had a bill once in committee. Did you ask me? I'm trying to answer it as best I can.
Let's stay on the bill and the report that we have in front of us.
Okay.
Chairman Speaker.
And I hear what you said there, but the words that you have in your bill doesn't say that. It says, in addition to the rules promulgated pursuant to subsection B, the commissioner shall promulgate rules to effectuate this section. And all it talks about is, to be a doula, you got to do those things. It's the words. In addition, in section C, or in C, in addition to the rules promulgated pursuant to subsection B, the commissioner shall promulgate rules to effectuate this section, including but not limited to rules for the collection of fees and rules regarding the imposition of discipline, including the assessment of collection of fines.
If I could, Mr. Chairman. And
Yes.
section B says, using the findings and recommendations of the Doula Services Advisory Committee, the commissioner shall establish by rule a process by which the department issues a verification of certification to a person who has demonstrated the following by providing proof of completion of a doula training program recognized by the commissioner. So if they have gone through that process, all the commissioner can do is verify that they have done that. And hearkening, it refers back to the report. And the report says, if you want to be in the 10-care pipeline, then go through the verification process. If you don't, then you don't have to.
Chairman Speaker, have you made up your mind?
Well, no, but I'm just trying to, once again, I'm looking at where that last statement, where's that in the language?
Which last statement?
The one you just made about the option. I don't see an option
All
in
right.
the language.
Using
Mr. Chairman,
the,
I'll leave it alone.
No,
I made my point.
So let me say, using the findings and recommendations, the section B, letter B, using the findings and recommendations of the Doula Services Advisory Committee. Now, what recommendations? Page 14.
I don't know any.
The committee recommends that doulas who do not choose to work with TennCare or the healthcare insurance plans are not required to go through the verifying process. The recommendation. Now, would it be easier to select all in the report and put it all in this bill? It'd be a 14-page bill.
Okay.
But our practice down here has often been to tell members, refer to the report.
Fair enough. I'm good.
Can we close the committee because we are out of time? Well, we are at an impasse, and I think members are looking at where do we go from here. It's past time. Yes, Representative Hakeem.
Okay, thank you, Mr. Chairman. I appreciate what you just said about an impasse. I guess looking at what our options are, I didn't know how much time we had left.
We are out of time.
No, I didn't mean, I apologize. I didn't mean today, but, during this session, or if there is a need to have additional time in a committee to go ahead.
Well, I agree with you in the sense that things are not complete enough for members to make a mind. I think we can put it to vote and let the members express their mind, their preference.
Mr. Chair, if I could, though.
Yes.
Don't want to interrupt you. In the interest of time, I'd like to get a one-week roll.
What is it? I'd like to get one. Chairman, Health and Hands.
I make a motion to roll it 1 week.
We have a motion and second. All those in favor, please say aye.
Aye.
Opposed? The bill is rolled 1 week. Thank you.
Thank you, Mr. Chairman.
And adjourn without objection.